Good evening, everybody. It's a pleasure for me to wrap up day 3 of the CIRSE Summit 2021. Together with me is Eric van Heuven, Mohammedi, Ramon Uberoy, and Bellarmino Gonçalves. I start with the birthday child, Eric. What was your highlight today? I mean, there are many highlights, but try to pick the best.
I think to be on the safe side, it would be the safety and durability in thoracoabdominal aneurysms because it's such an important topic. Both safety and durability are absolutely needed if we want to continue to improve endovascular treatments, even in the most difficult pathologies. There were many more highlights, and I was honored to moderate 2 sessions. And those 2 sessions, in my opinion, were excellent because the speakers gave us a very balanced view, and the sum of all speakers gave us a nice overview of the topic. And I think that is absolutely mandatory. And in addition to that, as usual in these expert roundtables, we had concise presentations and a lot of time for discussion.
I like that. I was looking at the program of ideas. I felt the stroke in TIVAR. Mo, you maybe help us with that. This is really a very important topic because not instinctively you think about it, but if it happens, it's quite a nightmare, isn't it?
Yes, you're right. That stroke session that Eric kindly moderated was a very interesting and very entertaining as well, because the amount of research is being done is quite enormous and very valuable, and the understanding, the rate of growth and understanding is quite fast. I really enjoyed it, and I really enjoyed the multiple approach how to tackle this significant problem, which is present in not only in TIVAR but also in even in cardiology world. Moving on, I think I started the day with a very exciting session. I mean, it was an early start, and after gym session and good breakfast, started with the amazing aortic intervention. And it was an amazing session, truly amazing session. The cases presented and you can see the lateral thinking, the innovation when people on hotspot. It's really, really impressive. Throughout the day was quite a lot of sessions. The final one I attended was the workshop on radiation protection. It was very carefully planned and delivered. It was really impressive. A lot of throughout the hour, Ondina Bernstein and Meryl Davis really did a very good job, and I encourage people really to look at that. And radiation protection, especially in the fenestration and branch stent where we spent hours there, I think people really need to look at that.
Sounds great. One question back to you again, Eric. I saw also the session with the stroke prevention, and it was kind of a nice study with the CO2 flushing of the devices. I think it's logic, but personal question, do you do it or on a daily basis,
I will be very honest with you, we don't do it. And actually, we asked Hamburg for all the tools, and we have the tools. And then we talked to our radiologists, and they were not very happy with CO2, saying CO2 above the diaphragm is not a good thing, but if you kind of replace air by CO2, it's the lesser of 2 evils. And you know, we continue to flush extensively the higher we go. We have to realize that 2 things strike me in that session. The fact that it's multifactorial, and for example, that the injection of contrast is one of the most prominent reasons for microemboli, together with the deployment of the stent grafts. Whether it's mechanical or air that comes out, I don't know, but it's multifactorial. And the second thing is that we need to have this multidisciplinary approach to address the problem, because what we know now is that silent events are not benign. And for those arguments, we need the neurologists, neuroradiologists to work on that, because as a surgeon, I say this is not my topic anymore. This needs other people to work on this a better way.
Yeah, I think the awareness was great, that how they created it. So you don't think directly to it, you have other problems in mind, but I think especially the silent ischemic events or embolic event are very difficult to tackle. And I think the cautious needs to be there on different levels.
Absolutely, and it was again a session in 1 hour that covered all the aspects, all the topics, and very balanced and very honest and open. And that made the whole session.
Excellent. I turn to my left, Ramon. Tell us a little bit about your favorite of the day, or maybe have a few favorites.
Yeah, it was a really interesting day, Christoph. So I was privileged and honored to be involved in a session where very senior colleagues shared some of their worst days in the angio suite. It was a real eye-opener as well in terms of how you can get out of these difficult situations. But it also reminded me, actually, complacency, you can easily get things wrong. Placing a stent graft in the wrong position, using the wrong markers, it's so easy to happen. You might have been putting these in for 10, 15 years, just one moment, and suddenly it's all gone wrong. So having consistency, using sort of fusion imaging if you're lucky enough to have it, but making sure you're really focusing on the basics and making sure you get that delivery system in the right place and deliver it in the right way. And having multiple pairs of eyes is something else. You know, sometimes you're so focused on one small area, one little thing, and sometimes you forget to look at the whole bigger picture. So I think that was really one of the things that came out from that, was use the imaging, use it well, and make sure you check and double check.
So you're talking about the my worst case in the angio, I assume.
It was yeah. So this was so that was what a couple of the cases really came out with that as a sort of key learning point, and there were several learning points. I mean, and I'd say I'm so grateful to colleagues for sharing the kind of things that have gone wrong. You often learn more for things when they go wrong than from when you have a success. The bailout strategies were amazing. So some of them were fantastic recovers from what could have been a real disaster, and learning from that scenario is fantastic. And I was really appreciative of the skills of some of my colleagues who were presenting and co-presenting, sharing that, and something you have to think about. But keeping the fundamentals, keeping the basics real, and having a backup plan, I think, is really important when you're doing any form of intervention, but particularly some of these complex thoracoabdominals, as well as some of the simple angioplasties, which was one of the cases I highlighted with distal emboli, which can so easily happen, and you need to be able to deal with these things. The other thing I'd really found incredibly useful was malformations. This is an area that's growing, and we're getting more and more involved with, and we can make a real difference to these patients. And this was the A to Z of malformations. What do they look like, the classification systems, how it's changed, how that determines how you treat those patients, and what agents you use for different types of lesions. That's really important. It's key to kind of getting the good outcomes. Avoiding using onyx in superficial lesions is something you don't really think about, but it's really logical because you get staining, and the patients really don't like that. And of course, it's something you don't think about. You want to use these agents, but there are better alternatives, and we need to use the right agents for the right lesion, and share our experiences, because again, we need to share our treatment strategies, and we also need to get data. Data is really key, because I think we don't have enough good publications in this area, and I think we need to get more so that we can really work out what is the optimal practice for our patients. So those two areas were really good for me today, so I really enjoyed that. So I hope colleagues out there will take the time to visit these sessions when they come on stream.
Very good.
Okay.
Bellarmino, your highlight of the day. I know you were very busy watching a lot of sessions, so
Yes.
give us a little
It was
wrap
an
up
excellent-
on your day.
Thank you, Christoph. It was an excellent day. Speaking about the AVMs, we changed to the AVFs. It was also excellent. The four speakers were so organized, from the clinical point of view until the technical point of view. So it's a very good technique. They spoke about the safety, the technical success, the fistula maturation, some clinical trials that assures the patency, the primary patency, the secondary patency rate. It was really, really perfect. You can see with this session, if you have the opportunity to see it after on demand, you realize that they create a real distal fistula, because sometimes surgeons, they cannot do that. But by a percutaneous approach, even a radial approach, you can really afford it. It's very important. Of course, always and never forgetting the clinical part, palpating, the pulse, if it is pulsatile, if you have a good fremitus. It's everything very important, but these two new medical devices, they work really well, and all of you have to see it.
Yeah, I checked the session myself, and I think what is very key, in my opinion, is the preparation and the evaluation, which really should be done typically by the operator itself. And I think it was shown very nicely.
Yes,
but I didn't want to interrupt you. You have more highlights.
No, very good, very good, very good. Of course, talking about endovascular, the venous, the deep venous recanalization, both experience of the experience of the two speakers, it's very high. In terms of MRI imaging, excellent pictures that all of you have to see in the pre-evaluation of the procedure, and then comes the procedure. Of course, it's a procedure not very well implemented everywhere, and needs to grow, because it's a simple procedure, makes a lot of difference in every patient, and it's very quick. It's the kind of procedure that you do, and the patient goes home, not in the next day, but on the second day. It's really amazing. You don't need, nowadays, in our era, to have a patient in 1 week. So everyone should see these presentations and start their practice.
Excellent. I know you also checked up the session with the upcoming clinical trials.
Yes.
Maybe can you give us a highlight there?
That's an area that has to grow. They showed us 4 nice trials that are in preparation, are almost beginning. So 4 RCTs, very well designed, 3 from Netherlands and 1 from France. So the first one, adding a checkpoint inhibitor, 2 checkpoint inhibitors to an intraarterial therapy. The other talks about the adjuvance of CIRSE, in many pathologies. After some therapies, they join the CIRSE treatment to the patients. It's very good. And another mixing, another study, which for me was a new one, never done, was adding the Olmium 166 to the after radiofrequency ablation. So you have to see that study. Probably is the future. We had the same issue with the chemoembolization plus thermal ablation before or after thermal ablation. Now, in a few years, we will have CIRSE before RFA or after RFA. We don't know, but it's quite interesting, this study design that they present.
Excellent. I think you heard there was a great day, a big variety of different topics. My personal one was looking at also was this priming the liver for lobectomy. I think interventional radiology plays a big role here, together with the surgeons, to find out the best way of treating this patient, respectively get them ready. There were options like radioembolization. There was this percutaneous ALPS. There was double vein embolization, and also the good overview of portal vein embolization. I think this shows you how important it is to work together, to collaborate and find out what is the best for the patients. We learned also in that arena that timing is very important. Portal vein takes maybe a little bit longer for hypertrophy, which can be a problem when in the meantime the tumor is growing. So a lot of interesting new insights I was able to learn from there. And as was mentioned already beforehand, one of the tricks or the issues of this wrap-up is to make you kind of like interested in even looking at cases or at sessions you could not follow today. As you know, they're all here on demand, and hopefully we inspired you to look at them. So thank you everybody to being here. It was a long day, it was a busy day, and I hope to see all of you tomorrow for the last day, the fourth day of the CIRSE Summit 2021. Have a peaceful and joyful evening, and we will celebrate the birthday of Eric. Thank you very much.
Thank you.